Let's do a quick exercise in what the conventional medical model would do with these patients behind me and what we did with these patients and see which makes more sense to you. So we have an array of very active competitive patients. So college lacrosse, NFL tight end, Radio City Rocket, high school athlete with a torn ACL. We've got a Heisman candidate. We've got a high school football player. We've got a world-class, multiple-time CrossFit Games champion. What are we gonna do with these people? And what if we had Medicare patients come in, or a work comp patient come in, or somebody who's sedentary come in? We would have to use a completely different thought strategy, wouldn't we? Because they're completely different. And what if he's got low back pain and she's got a knee problem and this guy's got a shoulder problem? What do we do? Because they've all got differential diagnosis issues, right? Wrong. If you're going to use the conventional medical model thought process, first you're going to evaluate their symptoms like pain, range of motion, gross strength, swelling. Then, if that's what you're going to be assessing, that's the only thing that you can go down the road for treatment. So then you're gonna reach in your toolbox and you gotta figure out, am I gonna use ice or heat, mobilization or stretching, soft tissue release or Graston, E-stim or ultrasound, cupping or needling, tape or brace, all of which are garbage because they only address symptoms. If you've got a thought process that allows you to get to the root cause of all of their problems, and all of these patients came in because of the same root cause, because they're all humans who have human physiology. So if you understand how to assess physiology and get to the root cause, you don't have to chase them. You don't have to chase their symptoms like pain, swelling, lack of range of motion with garbage like needling, cupping, stretching, correctives, tape, all that stuff, because you understand the root cause is neuromuscular and it's a physiological issue. So when you finally get down to the root cause, which is neuromuscular inhibition, and it doesn't matter if they're an athlete or they're a Medicare patient or they're a work comp patient or they're sedentary or they're active or they're young or they're old, it's all the same because they have the same human physiology. So when you address and assess human physiology, you get immediate results and they go back to doing what they want to do. This soccer player did her post-op return to play test at 4 months and aced it. Why? Because we got to the root cause of what caused her ACL injury in the first place, and that got us into treating the ACL injury. Radio City Rocket goes back to dance immediately because we got to the root cause. NFL football player, college lacrosse player, world-class, multiple-time CrossFit Games champion. They all go back to doing what they want to do quickly when you get to the root cause, when you chase symptoms and you get stuck in the conventional medical model and listen to things like assess pain, assess range of motion, treat swelling, treat pain, follow protocols. That stuff doesn't work, especially with your elite athletes. And if you want to know how to have a streamlined process that gets you away from the broken conventional medical model, you need to get in the shift.